Africa may not be experiencing COVID-19 casualties in huge numbers like the Americas, Europe, and the others, but the impact of the pandemic on the continent is equally alarming. The pandemic has seriously affected the continent economically, socially, and in many other ways. And for already vulnerable people in Africa like persons with disabilities, the impact on them is even dire.
I must confess seriously, because money is no longer flowing like before. For instance, my aged mother, that she is a petty trader, and at times she even assisted me with this money at times when I needed it. But now the market is no longer going on like before. COVID-19 didn't inform anybody that it's coming, and it's really suffered the persons with disability. I didn't benefit anything from the government. Even the palliative that ought to be given to us, the disability secretary had to fight seriously to get the little parts, and even the little that was given to us was not even enough for the number of PWDs in Ekiti.
COVID-19 made us to have low productivity, because the best we have by then, we have to sell some of them out, since we have production without purchase. You know, when there was knockdown, no people buy anything. People are not going out, people are not buying, and the little they bought were on credit level. So it affected my economy.
With bipolar disorder, we have manic episodes and depressive episodes which can be triggered by the events or circumstances that are going on around. And you know, with the COVID-19 pandemic, it brought a lot of fear, panic, anxiety, uncertainty about returning to a normal life. So for that, it's made all of us worried. I have so many friends who also have this condition who were having severe relapses around the time. And the lockdown also puts everyone in self-isolation. So even your support system that you may have at work or at school, or even seeing your doctor, was not available to a lot of people. So it wasn't easy. It affected a lot of us in so many ways. I, for instance, I didn't go for any review appointments to see my doctor for a whole year, because you are afraid that the hospital you are going to seek for help is the same place you might contract the virus, and the subtle mode of the virus transmission and contraction even makes you more afraid. So it wasn't easy for people with mental health conditions, and around that time too, people were also developing mental health conditions.
I use a white cane, and I go to a point, wash my hands, but I don't wash my cane. Then I finish washing my hands, and then I hold the same cane. So if there's a virus on the cane, it will get on my hands. Again, apart from my cane, I hold on to people's elbows. If the person doesn't have on a long sleeve shirt, if I sanitize my hands or wash my hands, you can say, okay, we can sanitize the person's elbow area. But if the person has on a shirt, a long sleeve shirt, at the point I'm holding an individual, there's no way I can sanitize the person's shirt. So if I wash my hands or sanitize my hands, I go back to that elbow to grip it, and if it means virus has gotten onto that portion of the person's arm, I go and grab it. Apart from that, using the nose mask. The nose mask has the portion that you are supposed to turn inwards, and you have the outward component, outward part of it. So yeah, for instance, like the blue one we have around, you have the blue side and the white side. Oftentimes, you as a blind person are not aware of which side is actually the white side and the blue side. You always need to depend on people. I've had a situation where I've worn the mask the wrong way, gone out for a while before I have been told you are wearing it the wrong way. Then you will say, okay, so then let me flip it over. But if you wore it the wrong way, you went out, a virus has gotten onto the outer part of it, which was actually the part that was supposed to be touching your lips, you now flip it and then you expose yourself. So you have the dilemma of keeping the wrong side, out, or switching it and then getting the virus. And unfortunately, looking at it logically, you will say, oh, then you should rather keep wearing it the wrong way than risk putting the virus on your lips. But with the way things happen, as soon as you are told, oh, you have it the wrong way, then you're also likely to just take it off and then turn it the right way. And then finally, people open doors and things with their elbow at times, but I don't find that too easy to do. And because of my disability, I happen to touch a lot of surfaces and touch a lot of things. So, it's impacted my life in that manner.
Social distancing for a person like me who needs support every now and then is a no. I can't. I mean, I'm getting into a vehicle. I would need that kind of a support, or somebody help me, unpack my wheelchair into the boot or something like that. I would need help. I'll need help if I have to go up a ramp and somebody has to push me. So that in itself is a challenge, and for as long as we are going to have to adhere to that, it is going to be a challenge to me. I mean, the hand sanitizers, yes, it's something I can use. It's something I'm used to. Washing of hands is also something I'm getting used to. Even though sometimes if I'm going to, let's say, if there's a Veronica bucket or something like that, using a wheelchair, and whether it's at an accessible point, it's also a problem. Some Veronica buckets may be up a particular platform or something like that, and it becomes very difficult for me to access that. So these are the challenges dealing with the whole lay down protocols. And I think that people are even getting to see how difficult it has been for persons with disabilities through the period.
It affects me in many, many ways. Because I'm a disabled person. As how you see me. If I don't move out for go look for me living, I'm not able to survive. But where this COVID don't come, it don't make sense. People, when they come close to you and they go far, somebody want to give you money, say it's free. You see, so if you don't treat, it's not easy for like guys surviving.
Whatever able person does for a disabled person, that must be a challenge. For us to keep the COVID-19 protocols, as a disabled person was not easy. For instance, if I have to wash my hands, I also have to wash my crutches, because if I fail to do so, it means after washing my hands, I have to undo the same crutch again. It's also a bit challenging for me. And also very, very difficult to stay without touching one another, without having contact with people, because some of us cannot do things by ourselves except somebody has to help us. I have to find it very difficult to see that my colleague disabled people also have the information, because some do not have television, TV to watch, neither a radio, neither they have Android phone to get on social media to access this information. And for some, they cannot even read and write. For those who are deaf and dumb, we have to find it very difficult to pass on the COVID-19 protocols, measures. And so all these, there are various challenges.
Organizations of persons with disabilities have not been spared of the effect of the COVID. The new way of life occasioned by the pandemic has affected their activities and also increased their cost of operations.
Most of our people in the communities do not have access to the technologies that will require them to participate in the virtual programming, which we fund. And so we think that even though funding hasn't decreased, there are limitations in terms of how far we can reach to the very poor and marginalized members in the communities. We know that in some of our organizations, we've had even some organizations closed down completely because of the many infections they had in their office. And the fact that we have some of our members whose immune systems are compromised as a result of their impairment. And so some are automatically working virtually. And so for those people, it becomes expensive getting them to join virtual activities all the time. Also, sometimes the quality of inputs it's reduced a bit, but as an organization we have tried different strategies, including running a shift system to ensure that indeed we are living up to the challenges of the time. We have a strategy of providing personal assistance to people, especially the members and leaders and staff who are participating in virtual programs, who are not too familiar with the virtual operations and the use of the technology, for them to participate in the programs. The cost of operations has gone high a bit because to begin with, you need to get together the technological equipment and facilities that will help you function effectively at a coordination unit. You also need the resources and the support for the members. So we've had a situation where we had to buy mobile phones. Some of the leaders had to get mobile phones, and we had to do that to survive their participation. And of course, funding, looking for resources to get the personal assistance as required are things we have done, and these have increased their cost of operations.
Persons with disabilities have attributed their predicament to the failure of their government and the World Health Organization to consider their peculiar needs in the fight against the COVID.
Now, if you look at the government's approach in dealing with COVID, it was a general approach. It wasn't targeted from the onset, and so it was more or less like the survival of the fittest. The one hot meal a day, some of the distribution points were at very hard to reach points. So even for a person with a walking stick or a wheelchair, it was difficult. And I mentioned the dietary requirements. I couldn't just eat anything because I have a compromised immune system, so I couldn't just go and eat anything. But then the government's approach was general, so it went to everybody, not targeting this group and targeting persons with disabilities. No.
I don't think they really paid attention to that area. They were looking at, oh, okay, there's a pandemic, let's all wash our hands, sanitize and all that. I'm not saying those things are bad. They are great, but they didn't look at the mental health aspect. If someone is in their home and they are having suicidal thoughts because of maybe anxiety or maybe the uncertainty of returning to a normal life, I can't call any helpline to be able to be attended to immediately. There's nothing like that. No one was thinking about that aspect. No one at all was thinking about that. There was no, when we look at even now that the kids have returned to school, there's nothing about mental health in the educational system. So even when the kids return and maybe I'm in school and I have my own fears and worries that now that I'm in school, will I contract the virus or not? No, there's no one to explain to them.
Globally, in identifying the protocols to deal with COVID-19, unfortunately, the world did not think about persons with disabilities, and in my case, persons with visual impairment and how they function, so that they always put a caveat in communicating the protocol. There's no caveat when they are communicating the protocol. They say 1 meter apart. So whether you are blind or not, keep your distance. Whether you're a blind person who needs somebody to assist you to move about, the simple interpretation is that keep your distance. So that poses some difficulty. And like I said, the development of the nose mask and things, the needs of blind persons have not been taken into consideration. Disease management. If I'm a blind person who gets the disease, how do I self-isolate? Taking into consideration my blindness and the fact that nobody ought to be by me. These things have not been discussed, and I think that it's unfortunate. When you look at our current situation of executing inoculation, that's the vaccination. Unfortunately, there is nobody having a conversation around whether or not the vaccine has been checked against those who compromise the immune system, and it's been noticed that it is okay for them to to take the vaccine, because ordinarily there are some of them who just don't take inoculations. Even before COVID, they don't take inoculations because of the kind of compromised immune system they have. So these are conversations that should be happening at the global level, not just at the national level. And unfortunately, they've not been had. So it poses a challenge to persons with disabilities who should be benefiting from their participation in mainstream society.
For governments to ensure that no future pandemic makes life this difficult for persons with disabilities, it is imperative that persons with disabilities are involved at every level of decision making in any emergency situation.
Governments should have doing something very inclusive. What I mean by inclusive, involving persons with disability in the initial planning, because nothing for us without us, nothing about us without us. When we are there, we can speak for ourselves. We know what is best and what is good for ourselves, really. Whatever planning process, if not even for COVID, persons with disability needed to be involved.
So the government should please let us be part of the decision making. If you don't move closer to me, you don't know my needs. You can't just come to me and say, oh Ellie, take this 50,000 naira. What if 50,000 naira is not my needs? It's not what I need at this moment. I will talk for myself. So I will plead the government to please make us part of their decision making.
There is a popular say, nothing for us without us. If say a person with disability has been involved in the planning or has been carried along, we should be able to give them how our needs at that particular time will be and how it makes it to assist us to solve our peculiar needs at that time. But the government did just say, okay, this is for persons with disability. We are not carried around to let us put our input so that we can tell them what we need and how do we need it.
We know that there are some people who have mental health conditions who got infected with the virus. I think that the government could collaborate with such people so that they can really identify what those people went through and be able to give their perspective of the situation. It will help them so much to plan, because when we look at stigma, for instance, people who had COVID-19 and were stigmatized at the time, they went through a lot of trauma. Those who were privileged enough to be in hospitals where they were given psychological service were able to do well. Some are still traumatized by the whole situation, but if we can get their lived experience, it will help with the planning, so that in case something like this happens the next time, they will know how to deal with such things. Maybe, for instance, if I had the virus and I was at home and I made a call and then the ambulance came and everybody saw me being picked, and I've recovered and I go back to my society. Now nobody wants to communicate with me. Given my experience and saying that, okay, next time when there's a situation like this, I don't think that we need the whole ambulance and the siren to come for everybody to see that I'm being picked. Maybe they could do it in a different way. Those people can really give their perspective. And also, daily rehabilitation centers should be set up. So they should also look at it from different points of view and call on different organizations to find out from them. Like Mental Health Society of Ghana, I would be very glad if the government could find out our perspective about the impact of the virus on people's mental health. It will help them in planning next time.
So in any future pandemic or epidemic, the idea is that in government trying to put up a response mechanism, persons with disabilities must be brought to the table very early in the day, and government must be amenable to suggestions that they will bring up to ensure that whatever that is being executed takes their issues into consideration and make sure that they are better served, because these are vulnerable people. And in fact, in the case of pandemics and epidemics, they either have a high rate of actually acquiring the disease or spreading the disease.
The approach has to be inclusive. The government needs to increase its involvement or inclusion of disability organizations in planning of interventions and implementing these interventions, even in monitoring how far they are able to impact the citizenry. for persons with disabilities, we would want to see the federation or the organizations fully represented in the decision-making bodies when it comes to these emergency issues, so that whatever intervention has been agreed on will definitely capture the needs of persons with disabilities.
As organizations, we are mindful of the risk associated with the physical engagement, but it can't be entirely ruled out. So we want our development partners and stakeholders to have confidence in disabled people organizations about their readiness to respect and adhere to all the COVID protocols to ensure that they have engaged their members at the local level. Also, there is a need for our partners to begin to resource our organizations, because COVID has come, but we need to also prepare for any future pandemic. And so engagement with disabled people organizations, specifically understanding their specific needs and ensuring that national programs, global programs and policies are inclusive of needs and issues of persons with disabilities and their organizations is something that should be done immediately, so that we're not found wanting. And we think that inclusion should be clearly defined and fully supported when it comes to implementation. So I think that is what we will call for as a disabled people organization.